Present these next couple cases, and also I'm working on my master's in TCVM, so I'm hoping to generate some good discussion about how to set this up in a bigger study.
Thank you.
So this is one of my favorite quotes, because from Jean-Marie Danois, veterinarian from France, that said, most injuries in horses are not due to one bad step, but the result of 10,000 not very good steps. And I think that's very true when we think about our athletes and the repetition that we ask them to do in whatever their job is. So when we think about our lameness, it's a huge economic loss to the horse industry, and it doesn't matter what the discipline is, and it doesn't even matter if it's your backyard horse, and if you want to go riding and you can't because he's lame, that has an impact on the owner as well. But when we really think about our performance horses, that is they're at a huge risk just by by what we ask them to do. And I love this photo that I took because you can see the amount of forces being put on that one leg as those horses are going. These are quarter horses as well. So really, to me, if we can get that, have the ability to detect and address subtle gait changes before the horse is clinically lame, a lameness that we can pick up with our eye, wow, could we really improve outcomes for the horse, less time being off, maybe less career-ending injuries. I mean, this might be a pipe dream, but these are things I think about, right? How can we really improve the overall well-being and outcomes for these athletes? So this is really where I've been going, is really trying to go upstream to prevention. And so I've been really thinking about, can we use the TCVM acupuncture scan to detect, combined with technology, and I'll talk about a couple options and modalities I'm using in these two cases, to detect subtle gait changes in a horse that is clinically sound and performing his job. And then can we use our acupuncture, come in, address what we see, and then come back, rescan the horse, use the technology, and then to demonstrate the effectiveness of the acupuncture on what we were seeing in that horse. So here's case one. And in the proceedings, I only have one case in there, but I had to bring two because there's really neat here. So this is the first horse, and once again, these are all quarter horses. So this is a 4-year-old quarter horse stallion. He was in race training and had no performance issues at all. Came off a win 3 weeks prior in an allowance race, and he was scheduled in about 5 days to run in a grade 3 stakes race. And this horse had no prior lameness. There was no history of anything that was concerning. And I always talk about the feet too. So this horse had aluminum shoes on, and he was due to be reshod because he was 4 weeks, which is pretty long for a racehorse. Usually they're reshod between every 3 and 4 weeks to prevent, especially quarter horses, because of how they run. A lot of times they'll overreach and rip shoes out if they're not pretty short. So this horse, and all the photos in here are ones I took, and this is the horse. He is a fire constitution guy. Let's just say wherever people are, he wants to be in the middle of. So the barns, in between the barns are the hot walkers and his stalls where they turn it off and on, and everybody knows and loves him because they have to pat him. So he is that quintessential fire horse. Had great chin, very healthy hair coat, and extremely fit. This horse was really fit, 3 out of 5. And I also, even though all I really do is acupuncture and chiropractic, for the most part, I can't help it. I have to palpate every joint. So I palpated all his joints, tendons, ligaments. Everything looked good. Everything felt great. Really didn't find anything on the physical exam that gave me any kind of concern. Felt his pulses, and I was like, I could convince myself they were a little wiry. And I was like, okay. And it looked at his tongue, it was a little purple, and he had some red sides to it. And I was like, all right, we'll see here. So I went ahead and scanned him, and this horse, I got a 2+ reaction on large intestine 18 and pericardium 1 on the left. Was not expecting to see that because, like I said, I was really expecting to come in and just do some points to support his constitution, support the spleen chi, right? That's really what I was expecting. So this got me thinking about, I wonder if we have some local chi and blood stagnation going on that left front foot. And so I went ahead and did a lameness exam on him. So had him walk straight on hard surface, front and back. We trotted, did flexion tests. And Lord knows I am not a boarded surgeon, but I kept looking at this horse and I was like, I cannot make a head bob. I cannot see where I see a stride that doesn't look good. Like I just didn't see anything from my eye that made me say, okay, this horse is not sound. So this is when technology came into play. So, and I know there's a lot of different technology systems out there, but the ones that I used on this horse, they're called Tendiboots, and they're literally like a sports medicine boot. It's awesome. You can put them on super quick. They contain battery and sensors and electronic board, then Bluetooth to an app on your phone. And what they do is they detect fetlock drop and the tendon and ligament displacement and estimate the speed and distance of the stride. And on your phone, when you have the app, you enter the horse, information about the horse. You measure the circumference of the cannon bones, so we make sure that everything is the same. You put those measurements in, whether the horse was shod, he's barefoot, if you're on hard ground, soft ground, straight line, circle, walk, trot, right? So it collects those parameters. And so how they detect change in gait is based on an average load of the horse you're looking at that is set against a standard deviation from an established upper and lower threshold that was done during the development of the boot. So it looks at what that horse is doing against what is considered normal. So here's the results, and this is the first time this horse had the boots on. And so what we can see is it was detecting that this horse was landing almost 60% harder on the right front versus the left front. And remember, he was reactive on the left front foot points. And so there was recording more pressure being put on that right front leg, and that right front leg was staying on the ground. Just, we're talking microseconds, so our eye can't pick that up, but it detects that. And then when we look at the graph over here, maybe I've never been online here. So what this is over time. So to make sure this isn't just a fluke thing, right? The top, I should say here. So right here is where the pressure being measured, and this is over time. The left is in blue and the right is in red. And so what we can see is that it's consistent. This horse, every stride, is landing harder on the right front versus the left front. So it's consistent. This wasn't a fluke thing. So then I use a little bit of thermography as well. And I don't know how many people here use thermography at all. Does anybody in here use it much? Oh, that's great. And so it's a highly sensitive infrared thermal camera that measures, and compiles, analyzes electromagnetic energy or heat emitted from a patient, and then it converts it to a temperature scale, and this is the one that's more commonly used. And these are the raw images here, because you can put them in software and kind of get rid of the background noise. So these are the raw ones here. And then the temperature directly correlates to changes within the circulatory, nervous, and musculoskeletal systems. And so, for instance, on the top one, these are the horse's heads up here. This is the tail. This is the hindquarters. You can see there is a difference between left and right here. And this is a 2-year-old quarter horse filly in race training. And look at this carpus. There is a big time heat signature in that left front carpus on this 2-year-old. And when we think about thermography, Tracy Turner who is at the University of Minnesota, has done a lot of work on thermography and its ability to detect changes about 2 weeks before the horse is clinically lame. They've looked at that in racehorses, especially for tendon and ligaments and joint issues, and it was done, a lot of his work was done at Canterbury Park on thoroughbreds. But it's been shown that you'll see these thermal changes and before we actually see lameness. And like I said, there's a lot of papers that he's done looking at that. So I went ahead and did the thermographic exam on this horse, and his left front foot lit up like a Christmas tree. I mean, it is way more heat in that left front foot than the right front foot. So at this point, I'm like, all right, we have the scan, we have the boots, and we have the thermography, and we can say they all are showing us this horse has some issues in this left front foot. So now with treatment. So I went ahead, and this horse, being a fire horse, chews on everything. I don't know how many, good thing he's a stakes horse because he chews lead ropes in half like they are going on style. So the trainer doesn't mind it because he runs good. But put bladder 10 in him, and it's nice because he just completely relaxes and he quits chewing on everything. Then I did the 4 gates, so large intestine 4, of course, to clear heat, but also to help calm his mind. And liver 3 is our great point, as we all know, for moving, clearing stagnation. And then on him, because of the scan, he did not really show sensitivity at bladder 13, 14, or 15 to point me in a direction of whether toe, heel, where that was, and as well as the thermal image showing the whole foot inflamed. I just kind of chose some dry needle points and around it. So I did triple heater 1 for the front, and then I did the classical point Quantimin for the local points. And because the foot is associated as the domain of the liver, I wanted to tonify and help loosen stagnation there, so I did the back shoe points, bladder 18 for the liver and bladder 19 for the gallbladder. And then I did a couple points distal to the foot. So I did triple heater 15 and large intestine 16. And despite being a fire horse, this horse loved acupuncture. And he just would melt and loved it. So I did electroacupuncture F1 at 3, F2 at 0, 10 times power for 20 minutes. And but he would not tolerate bleeds on the lower limb. So I had to kind of do the distal points and then the back shoe points. And then this horse afterwards was reshod. And he was reshod with no vibes, and I don't know how common they are in thoroughbred racing, but quarter horses, they use them a lot. They're an aluminum shoe, but they have a little pad, kind of a shock absorbing pad that goes around the rim of the shoe. It doesn't cover the sole. And when they noticed this horse had a 1 degree angle difference, really not much, but there was a little bit of an angle difference in this horse. And because of that inflammation in that foot, I started him on Hot Hoof 1, and I know prior presenters have talked about this formula. It's a great formula for helping dispel damp, clear that liver fire, move that stagnation, and really just help do that. So I put him on the concentrated formula, 15 grams BID. And normally, I would not have come back and looked at this horse for 2 weeks, but he was in a big grade 3 stakes race in 5 days. So I came back in 24 hours. So I repeated the scan in 24 hours, and this horse was non-reactive. I was like, all right, that's a good thing. Let's put the boots back on him. So put the Tendiboots back on him, and for all practical purposes, this horse's gait had normalized. He was less than 1% difference between left and right, and when you look at the graph over time, he's landing really evenly, consistently. I was like, all right, let's do the thermal camera. So I did that, and you can still see there's a little bit of extra heat in that left front compared to the right front, but we're only 24 hours out. Like, I was tickled. Like, I was like, all right, this horse, we were good to go, because the trainer was a little concerned. It's like, well, he's in a run, he's sound, but you're telling me he's got problems, right? So it was kind of one of those things. But what's fun about this horse went on and he ran third in the grade 3 stakes race by less than a neck. He went on, and we'll talk about it, but he went on to have a very successful season. But anyway, so that's case 1. Question?
Was the difference in temperature at all palpable between the front feet?
And the question was the temperature palpable by our hands? No, at least not by mine. They could not feel where I was like, I guess afterwards you can make yourself, right?
Yeah.
But when I was going through before I ever put the thermal camera and palpating joints and ting points, I wasn't like, it's like, ooh, that left front foot feels warm. But I'm sure, my bias after I knew that was hotter, I probably would have went back and felt it, but nothing too appreciable. And so this is case 2. This is also a quarter horse. He's 7 years old, and this horse was in training as well. Had just come off a race, ran third. He's having a good race about 2 weeks prior, I think. And this horse goes 870 yards. So one of the interesting parts about quarter horses, they run anywhere from 200 to 870 yards. And 870 is just shy of 5 furlongs for people who work with thoroughbreds. So he goes all the way around the turn. No prior lameness. This horse currently had those no vibe shoes on, was shot a week prior. Like I said, had been training really well. So with this horse, same thing, had really great shin, super fit, and palpated all his joints and tendons, ligaments, looked great, had really good hoof balance, at least the naked eye, right? Everything looks good there. His pulses were a little wiry, but his tongue was pale, and I'm talking dry, like go to part those lips and just dry. And I was like, okay. And this is a very woody horse too. So went ahead and did the TCVM diagnostic scan on this horse, and he was a 1+ at triple heater 15 and small intestine 16 on the left side, the rest being non-reactive. And so as we know, those points are for the tendon and ligaments in the front leg, and so that really got me thinking about that. And then because of that, his tongue being so pale and dry, like it just like, ooh, do we have underlying, liver, blood, and yin deficiency going on that's, we're heading that way to having a problem. So put him, but we have a question.
I'm not very familiar with quarter horse racing. Do they go around or they go in a straight line?
They do, well, kind of both. Okay, so the question is about quarter horse racing. How do they run? Most of them run in a straight line from 200 to 440 yards. And then there is what he does, which is 870. So they'll set the gates on the back side of the track and they come around one corner of the track. Yeah, but it's always to the left. Yeah, but that's what he did. He actually came around the turn, and they call them hook horses for the lingo with quarter horses. So then I went and put him through the paces as well. We did a walk and a trot on hard ground straight away, did flexion tests. I could not make this horse take a lame step either. And I was like, okay, see what's going on. Put the Tendiboots on him, and this was the second time I had seen this horse. So I have longitudinal data on this horse. So, which is neat about this. So these are the 2 data points from about a month, I think it was about a month prior. He was landing perfect. These are the two data points from the exam today where he was reactive on the points for the tendon ligament in that front foot, and we can see a deviation in his gait. And the same thing here, he was landing harder on that right front foot, more pressure was being recorded, and that right front foot was staying on the ground longer. So it was nice to see this because we could say, well, we have a big deviation in how this horse had been moving. Then I did thermography, and same thing here, it was pretty, I was not expecting to see this, but I mean, you can look how much heat is being recorded by the thermal image on that left front leg and really on that superficial digital flexor tendon. And then we did an ultrasound, and I used to do a lot of these. I don't do as many anymore, but I did an ultrasound on both sides, and I didn't see anything. But to be on the safe side, I sent him to a board of surgeon at Iowa State, and I was like, can you just take a look, make sure I'm not missing anything that's making, that I should be seeing. He didn't see anything, I didn't see anything. Like it was like, all right, for all practical purposes, this horse's tendon ligaments are normal, but we're being reactive, we're seeing a change in gait pattern, and we're seeing some heat signature. So I went ahead and did acupuncture on this horse, and because he's a wood horse, I kind of vary my, permission points depending on what I'm doing and what the horse's constitution is, but I did gallbladder 21 on this horse, being a wood horse. And then I did the 4 gates as well. Once again, large intestine 4 helps clear the heat, but in this case, it's also a local point for tendon ligament issues. And liver 3 to help clear stagnation. And because I was concerned about some liver blood deficiency, I added spleen 9 and bladder 17 in there as well. And then I did other local points, so small intestine 4, large intestine 3, and small intestine 3, all local points to the tendons, and the classical point of Ming Tong. There's some other points I would have liked to have done, but he was a wood, and this was it. This is all we were going to get any of that day. So I did electroacupuncture on him, same thing, F1 at 3, F2 at 0, and I only got 10 minutes on him. I would have liked to have done 20, but like I say, he's kind of a funny horse, so this is what we were able to do. But I went across the tendon ligaments with large intestine 4 to large intestine 3, small intestine 4 to small intestine 3, and then bladder 17 to bladder 17 and bladder 18 to 18. And I don't know if you can appreciate it, there is a little piece of his tongue kind of right there. I mean, there's like no color to that tongue, just super pale and dry. And this was him after we were done doing acupuncture on him. He made me a little nervous with the tape. I was going to get a video, and I thought, I better be on my toes. So we didn't do it, but we got a picture of him afterwards. And then I started him on tendon and ligament formula as well from Jin Tong. So same thing, the concentrated formula. So he was on 15 grams BID. This is a wonderful herb for underlying liver, blood, and yin deficiency, as it contributes to the tendons. And it has those individual herbs there to help nourish blood and yin, move stagnation, really strengthen those tendon and ligaments. So we started him on that formula. And then here's where the conversation got interesting, because they wanted to enter this horse to run. And, because for all practical purposes, we ultrasounded, the horse was sound, but there was some underlying issues and concerns with the superficial digital flexor tendon. And so I convinced them to say, no, let's institute, and I'm going to call it a mini rehab, because it's not really rehab because we didn't have structural changes, but the last thing I wanted to do was have him enter this horse, and then he goes out there, and then now he blows a tendon, right? And I felt that was a real risk with this horse. So he did ice therapy. These are some pretty neat ice boots, big zippers. They did a lot of ice therapy, a little bit of laser therapy, which was talked about by other colleagues today. They did some standing wraps with some poultice. For any of you who spent time, I'm sure anywhere, right? Everybody has their favorite leg poultice that they use. And then we did they did put him on bute. We did put him on bute for 3 days, 1 gram BID, and then he was off after that, just did a short course. And kind of did a mini rehab program. We did hand walking only for a week, and then we did backtracking in the second week. And so what backtracking is, they take them to the track and they go the opposite way and they long trot them. They never gallop them, they just go to long trot, and they call it backtracking. And then he went back into galloping at week 3. So I came back and saw the horse at week 3, and he was still on the tendon ligament formula, repeated our acupuncture scan, completely non-reactive, no sensitivity detected. You have a question?
What was his tongue like? Do you remember?
Oh, on the repeat, okay, the question is, sorry about that. The question is, what was his tongue like on the repeat visit? It was a little better. It still was dry and pale, but a little better. And his pulses still were his pulses actually were a lot better. I didn't detect the wiriness, but I definitely felt that kind of that thready, guinea pulse on him. And so there was no sensitivity detected. So same thing, I tried to keep it consistent. Went ahead and did a lameness exam on him again. Same thing, walk straight away, trot straight away, hard surface, circles each direction. Did the flexion test, looks good. Repeated, put the Tendiboots back on him and got the measurements. And as you can see now, I have that longitudinal data. This was before, this was the visit 3 weeks prior that showed a change. And now we're seeing a normalization back of his gait. And he was landing for all practical purposes perfect on left versus right front. Repeated the oops, I have a question.
Oh, I was just gonna ask, why did they originally have you look at the horse since he wasn't lame and wasn't symptomatic at all?
Because the question is, why did they have me look at the horse? Probably either one of them, right? Because they weren't having problems. Because this is a great trainer. I see their horses every 2 to 3 weeks, and we go through and do preventive acupuncture and spinal manipulation on them. Yep. And we'll talk about that, actually, what that gets to with this barn here in a minute. And so then I repeated the thermography, and you can see there's one tiny spot where there's increased heat signature, but there was a little hair loss here. This from the poultices, we had a little bit of scurf and some hair loss, so that's why there's that red area there. It's superficial from the hair loss, but all that heat went away. And so this was, and what's been interesting, so now I've been digging into the literature, and this is where I'm hoping we'll get some good discussion as we go forward here. When I was looking at the literature, this has been very interesting. We all know the TCVM scan, when you look at the literature, shows very good correlation to our Western diagnostics. No matter where the study's done, what population of horses, it has a very good correlation. But what I found very interesting, in all of those studies, there's a small subset of horses that will be positive on the scan and all normal on the Western diagnostic side. And so when you look at reasons for that in the literature that people, when they cite, whether it's, is it just because you had somebody different, is a difference in scanning technique this time versus last time, maybe not enough pressure, too much pressure last time? Is it because now we're detecting things at the chi level before we don't have the Western diagnoses in order to detect what we're seeing from the scan? So that I think that's very interesting. And in these two cases, this is what I saw. These were sound horses that I was detecting problems, and we had technology to back up what we were seeing. And then, in a lot of studies, when you look at this, a lot of us through experimentally induced lameness and then the impact of acupuncture. And so I think there really is a need to design a study to look at it more upstream, where we can look at these horses and be able to track them and have some quantifiable data on them for gait, thermography, using the acupuncture scan, and then be able to follow these horses through their career. Because, and I know this is only an N of 2, and we can talk about, I have used it in a bunch of other horses, and I have other examples, but what I'm presenting here today I know is only an N of 2. But when I scanned them, that TCVM scan never ceases to amaze me what it can detect. Even with, that's how I've gotten into barns at the racetrack, because I'll say, look, I'll come scan a couple of your horses for free, I'll tell you what I find, and I'll go in, they'll be like, well, it's a knee, it's this, and they're like, and I never take the horse out of the stall. And they're like, how do you know that? You never even watched him walk. But yeah, the vet, my other vet was here, and then he injected whatever. So it never ceases to amaze me, the power of it. And then now I was able to take the Tendiboots and be able to quantify that gait asymmetry that at least my eye, and you never know, right? There could have been other people maybe have a little keener eye than I do, and if we had a bunch of boarded surgeons there, maybe they would have detected something that I didn't see, but for my practical purposes, those were sound horses in competition. There was no concerns by the trainer on how they were training. And then, that was also, we found the thermography, and we know that has been established by Dr. Turner to be able to show some changes prior to lameness. And then I was able to come back, treat these horses, and then see resolution of those areas of concern. So I really do think this is a neat area, and it really interests me because I want to figure out how we can prevent lameness and unsoundness if we can, to a point, right? And keep these horses going well. So I really do think we have some further studies and figuring out how to identify that population of horses and how to follow them through a season. But I will tell you anecdotally, the 2 barns that I convinced enough, I guess maybe they had owners that had deeper pockets than some others, that horses that I saw routinely every, say twice a month to once a month through a racing season, they had way less lameness, way less soreness, way less joint injections, like their outcomes were way better than the ones in the Hail Marys. Like I love that term that she was talking about earlier, because it is true. You'll get called in and it's like, oh my goodness, this horse is so sore everywhere. Okay, we need to see him back, and then you don't, So it is kind of, it's nice to be able to follow those, but I do know in those barns that I've been able to follow and get their normal gait pattern and be able to do thermography and do the scan and be able to treat what I see, those horses have had better outcomes.
What's your approach? Do you do your thermography before you take the horse out of the stall, or do you only do that if you find something that's of concern?
And the question was, what's my approach to the thermography? And so what I usually do with those horses, I will scan them first, then I go watch them walk and move and do my little lameness, then I'll come back or put the boots on them, and then I'll do the thermography. But I try to do it on all of them. And the reason is, especially in quarter horses, 2-year-olds, there's a lot of carpal chip fractures in 2-year-olds, and so I like to keep track of those horses' knees. So I always make sure that I'm scanning all those horses and I have the data, and because it helps us detect very subtle differences and changes. So I try to do it on all horses, if they'll let me.
And practicality, how does that, in your workflow, how much time does that take?
I have initially, well, I was trying to do it, I had one technician, we were trying to do it all ourselves. It kind of added quite a bit to it. Now I have another technician that I'm helping train to do the thermal imaging, and so it's lessening it up. But I think to do all those things, either you need to have somebody help you, or you have to charge quite a bit. And any of you guys have been on the racetrack practice, it's boom or bust, and when they're winning, they'll spend money on them, and when they're not gonna. So, but yeah, so I try to keep it, where I can.
So I haven't priced these things out yet, the Tendiboots or the thermography machine, but how long do you think it's gonna take you to recoup your investment in that?
The Tendiboots recoup my cost in those within about the first 3 weeks. They are not expensive.
Like $3,000.
Yeah, they are. No, and that is why, because I know there's a lot of other systems, there's the equine locum, and that's what actually led me to looking into finding the Tendiboots. I called, before I even knew about this company that makes them, I got a hold of the Equinosis system. And then I found out it was $25,000, and I was like, that is not gonna work for what I need. And so it got me searching, and that's how I found them, because I wanted something quick and easy that I could put on. I have this, quantifiable data that I could do and not add, because we all know our practices are busy, and the last thing we need is to be spending 20 minutes setting something up to get measurements. I mean, this thing, like sports medicine, once you have their measurements, boom, boom, boom. And like on my young horses, the 2 and 3-year-olds, I'll remeasure a couple times just to make sure those cannon bones as they grow, but I mean, it's quick. So, and then the thermal camera, it took a little longer with that. I have a FLIR, so it's a FLIR model, that, for the cost of that camera was about $6,500, so it wasn't horrible. And I, did that through AEP during a show special. The thermal camera.
Dr. Pride, great job using your veterinary preventive medicine degree to actually prevent injuries and begin to build data to prevent that and train, the people who take care of the animals that have the closest relationship to them, begin to have them see that it's not, I know my name's Hope, but it's not hopeless.
No.
Like, they don't have to end up in a bad spot and put pets, the horses out of pasture, but my question is, so great on that, I love it. We love it, and I'm speaking for everybody. So what would you do? So if you had, so I got this data, like the pre-data, right?
Yep.
But what would you do with the ones that are injured? Like, what would you expect your data to say with the thermography? Like, how would you expect it to look in a 6-week course of treatment?
Well, what I would expect, and it can be used that way, I guess I haven't, but if you have a horse, say you're rehabbing from maybe he's got a suspensory, and so this all still has use for, you can put those Tendiboots on the horse. Where is he at today? Let's do our acupuncture, let's do our herbal therapy, let's recheck him at 2 weeks. And so you should be able to see progression and improvement in that horse's gait, and so they can be used that way as well to tell you when is that horse able now to go back into work. So I think there's utility there. The other thing I've thought about as well with these boots, and this kind of gets at some of this, when horses, quarter horses and thoroughbreds train very differently. But with quarter horses, they will do short works. They'll do short works, 200, 250 yards, and and the question then is, okay, that horse has been worked. How much time should he have off? Can he be galloped in day 2, day 3, day 4? Because we all know when we have works or races, we're gonna have some muscle soreness. We're gonna have some changes just by the nature of what we ask. So that's the other thing I want to look at. Like, can you use that to say, okay, how long does this horse need to recover from a work or from a race, and see where does his gait, does it go abnormal? Does it stay normal? You know, kind of looking at those things. I think there's utility as well to look at this with feet as well. We all know, and that's why I talk so much in these 2 horses. These horses were balanced, so we didn't have confounding there because we had some really bad farrier jobs. These horses looked good. But I think all of this can be used on horses that have lameness to see the effect of your treatment and to see how they're doing, how they're progressing. And then potentially when you can say, all right, yeah, he looks great, go ahead and start him back into work. And then be able to see how that horse does. I think when we think about tendon and ligament injuries and rehabbing, there's some challenges sometimes there. How much when, how much is too soon, so we could use all of this to even do that with it.
Well, the other thing that I was thinking about listening to you talk, and that's after that question is, you know, I mean, none of us are getting younger. And our eyes and our minds are our data. But I can't upload a SIM card and give it to a young vet.
Right.
And these surgeons are brilliant. I worked with Chris Kalchak, you know, before I went to vet school. If I had gotten a SIM card, I'd be, you know, so do you think there's an application then for utilizing your ultrasound of the tendon, the boot, to get that gait analysis standardized, even amongst, like, I mean, if I could design a study like, Wave-Wagic One, I would get 5 surgeons in a room with 100 horses, or a pasture with 100 horses and those boots, and then start to standardize how closely are their eyes compared to the boots. But like, this could be a major application for young equine vets to feel successful.
Absolutely, yeah, absolutely.
Yeah.
Absolutely. Yeah, because it is, I mean, we all know lameness exams, there's an art and a science, right, to it. And I think when we're young, sometimes we can overinterpret. I think sometimes as I get older and more gray hair, I think I underinterpret sometimes, like, oh, it's, you know, or maybe, you know, so yeah, there's definitely
Yeah, plus that Generation Q is gonna love looking at their phone for one more dang thing.
well, you have something you can show, like, that was part of the deal with the second horse was like, look at this. This horse, look at the change, and we had longitudinal data. And like I say, what was fun with these horses, and to give it the outcomes, this is that first case, winning his last allowance race. He never had a problem the rest of the meet. We just did points on him, acupuncture to tweak him, and he never had a problem. The rest of the meet went on, was very successful. The other horse had 2 more outs, a third and a win, retired sound. You know, and the question becomes, you know, I think I've had somebody, we don't have that magic 8 ball. What if none of this was detected in these horses? Would that have caused a performance problem? We don't know. But but all I can say is I know when these horses ran that they did not have a lameness problem. They were tracking even. They weren't reactive on the diagnostic points, and the thermography was normal. And these horses went on and they had very successful race meets. So that's what I do know from it. But I'd like to dig into this a little deeper with more of a controlled study a little bit, but looking at it more from the prevention side of things, not seeing horses that already have lameness, but really try to follow some of them through their season when they're sound, and then go through the season with them and treat what we see and use technology to help demonstrate our effectiveness.
So I think we all need to give Dr. Pride a very warm thank you for a wonderful. So we have a 15-minute